and Miss Panel. Good afternoon. We're live now. I'd like to greet our colleagues, Alonso, José Carlos, and Felipe. Welcome to our panel on artificial intelligence and technology in the future of prevention. I'm Bernardo, Manager of Technology and Innovation at Ask. And to start our conversation, I want to propose a few questions that probably do not have an answer yet. For some others, we already have greater clarity about. So let's start our conversation to talk about the state of the art in this industry. Alonso, the medical director for Microsoft Latin America, will talk about his experience. Dr. José Carlos Prado Júnior will talk about his experience as a physician. And Felipe Ricci, the head of innovation for health at Stefanini, will also give his contributions. Whenever I talk about this subject, I mention a sentence by Stephen Hawking. He once said that all aspects of our lives will be transformed, and this is probably the biggest event in the history of civilization. And this sentence has a lot to do with the world that we're experiencing now. There's a lot of information about the growth of in the amount of data and data sharing, the growth of technology. Yesterday, I was watching a lecture here, and a physician said that every 72 hours, medical data, gets twice as big. So if you think about a reality in terms of civilization, that's huge. We're going through a huge digital transformation. And now in the health industry, we have artificial intelligence as a guidance for our future, or as a driver of our future, better said. And one thing that I'd like to mention is what's the penetration of artificial intelligence in healthcare? Well, I work in healthcare management at Ask. It's an administration company, especially for supplemental health, but we also work with occupational health. And in our experience, our main focus is the application of data to help optimize the treatment of patients and the collection of clinical data to define diagnosis. And it's based on that, we've been seeing some initiatives and good progress correlating imaging exams as an assistance to diagnosis. So always thinking about artificial intelligence as an ancillary tool to diagnosis. In addition to that, on August 28th this year, the WHO published an article on artificial intelligence and its evolution, and they mention important aspects about data privacy and about aspects related to patient care, their privacy and security. And additionally, there's also a few other publications, and I brought one that I think is very interesting from Harvard that talks about where the top 10 applications of artificial intelligence for the next few years will be. And they predict that by 2026, the top three places will be robot-assisted surgery, virtual assistants to nursing, and a process control in the administrative area. As a second aspect, we can also talk about security and safety, and maybe the third and fourth aspects, maybe for those we could talk about, well, artificial intelligence is a tool, and just as with any tool that we invent as human beings from the wheel and from then onwards, it can be very well used for very important things in our lives. And we, as the leaders in technology and market leaders, we have to think about the risks that that can bring about, which oftentimes are not very clear, especially because we get carried away by having new things and the benefits brought about by these novelties. And I think that with these three things, for one, healthcare is already enjoying the benefits of AI. And what are the dangers in terms of danger to information? We can talk about the General Data Protection Law. In Brazil, it's been at the center of many discussions politically and in terms of administrative discussions. And maybe in that regard, Alonso can give us an idea about the data protection laws outside of Brazil and tell us about what that is looking like right now abroad. And if we look at the future, where we can see the good applications and the risks of using that technology. So if you allow me, I would like to ask Felipe to first introduce himself and also talk about your perspective. Please, you have the floor. Well, thank you for the invitation. I also want to thank our colleagues for the opportunity to exchange information. And it's important to talk about how technologies can have a positive and a negative impact across different industries. And to give you a panorama, at Stefanini, we work very strongly with the perspective of the future, where we have some frameworks that understand what are the possible future scenarios 5, 10, 15 years from now in some segments. And when we started working on prevention and technology and how these two segments get connected, first we set out to look at the future and understand what drivers were going on, and to try to create a path that makes sense. And with that, we brought the ecosystem as a whole, doctors, patients, industries, companies, to understand that. And with that, we saw that this trend, it's a growing trend in terms of how to work on health promotion and prevention. It actually exists. And in the future, in the next decade, it will have a huge impact on economy and society as a whole. So this theory is validated, so to speak. And with that, we then started to understand how to take the opposite path. If we understand that the future is about thinking about prevention and promotion, and then you start having a mix of prevention, promotion, and well-being, these three aspects start converging somehow. And when we did that, we understood that we do have a possible roadmap to get to these future scenarios and to reach these so-called preferable futures in terms of providing education to people and giving them tools that make sense to the community as a whole, and that are not simply items that are there but do not make any sense at all. So we started to see that there is a very important aspect that, and speaking from the perspective of a biomedic engineer, we sometimes overlook design. And last year, I focused strongly on understanding how design, how the creation of an experience and specificities in people's lives are important if we want to talk about prevention, whether it is through technology or not. So again, technology is always a means to an end, and the end is for people to understand that they have to change. So how can we do that in a fluid manner that will not create friction and that really makes sense to everybody, to economy, to society, to everybody? And with that, we were able to identify how each player has been operating or can operate in that regard. So we drew a map of several players, pharma and tech companies, the government, and how each one was behaving and moving along that path. And we started also looking at the financial aspects, banks and also retail, which can give support for us to create a cycle where this cycle makes sense to everyone, and so that we avoid cannibalization, that everybody can profit and create a relevant experience to patients. So when we looked at this entire ecosystem and when we started thinking about solutions for each of them, we saw that technology is supported by design, by this experience that we want to build. And it's also connected to what people demand. So it's not enough for us to think that prevention and technology will be there, we're going to use it, and that's it. We have to understand what they need today, what the legacy allows them or leads to the existing problems, and how to pave the path towards the future. So there's this complex movement that we have to make, and which is important, and it's all about legacy and the present, what people are experiencing today with the pandemic and post-pandemic, and how we can work with this movement, this moment between pandemics, as apocalyptic as it may sound, and the future, what people are thinking about for the future, for society as a whole. So working very well with these three major areas is relevant, and it brings about very good results because it adds value to everyone. So we bring these this ecosystem and these three moments, past, present, and future, and we're able to pave this path in a way that there's no cannibalization, and that people understand how to support each other. And permeating all that, of course, technology includes AI. And in a nutshell, I would say that this is what we're thinking now, and this is what we're working on. So with present, past, and future, and also broadening this ecosystem of healthcare as a whole.
So I think that you have mentioned something very nice in what you said. In addition to past, present, and future, you talked about engagement and how we can launch things which sometimes may engage. And this point is really crucial. And here in reality where we work, when we had the pandemic, well, it's impossible to talk, to have anything during the pandemic without talking about the pandemic. So we launched our telemedicine services, and we already had something like that, and we were really worried about engagement in our surveys. The response was very good. I think that telemedicine is something that came on very strong. We had 90% of our telemedicine users would use the telemedicine services again. So this is a very strong piece of information for us to go on. So let's get the example from telemedicine and take it to other areas. And then I would like to involve Dr. Alonso to talk a little bit about the reality at Microsoft. Please, Dr. Alonso. Thank you very much. Well, first of all, I would like to thank FIS for allowing Microsoft to share its experiences. And I apologize for my Portuguese that is non-existent. Well, in the first part, as a doctor and a Latin American physician, we have a few significant challenges in our region, which are shared, well, from Mexico to Patagonia, including Brazil. And there are some shared features in the way we work, and we share the same limited funds for health, chronic diseases, problems with infectious diseases, and a young population with risks, social risks. So these are some of the themes that we have in common. Now, the pandemic has shown us the technology, and when I talk about technology, I'm talking about IT information systems, information technology. They are enablers for health that were not seriously contemplated before. So I would say that in terms of industries, health is the one that had the more used the less technology, or at least acknowledges the least. So we have lots of medications, therapies, many things, and we need to use. But now, when we talk about information, patient information, we have a huge challenge. And so emergency patients that are unconscious, it's impossible to know their history, allergies, and then we have a work that may be very difficult. In the area of chronic diseases, the patients sometimes migrate. Sometimes you don't have very long to see patients with diabetes and hypertension. It's not enough to just give them a formula or a combination of treatments. This is the face of people when they get to the health system. In terms of those working in healthcare, we need to worry about funding, costs, operational availability of human physical resources, appropriateness, administrative processes for authorizations, and so on and so forth. So health is very complex, disconnected. Unfortunately, there are initiatives of interoperability, and now they are providing the first results because you're having some standards defined. But our industries, in other industries, they solved it years ago, for example, in manufacturing, banking. So there are some processes already working in terms of interoperability. Within this very wide-ranging spectrum, we have a problem of technology. It needs to be teamwork. We need to invest our best capacity. At Microsoft, gets in a significant point is Microsoft has been working with the health industry for more than 20 years. So we know how to include technology. And now with the pandemic, this was became very evident. So Microsoft, yes, we are providers of technology, of technological capacity. And today we have business associates that use these capacities and that enable solutions for our customers. These capacities, for the first time, Microsoft concentrated all of them in the industry, which is called a cloud for health, which is a cloud for health. And what does it mean then? So it's not just a database or a set of applications. What Microsoft wants to do is first to have a system of information that is standardized, that is uniform. So there was no standard in the industry before, but it is operational. So there is a server, defined parameters, and all the implications. So consume it as a service. Still agreeing with it. There are information from different locations in different formats that needs to be harmonized and implemented. And when they are implemented, you can do many different things, analytics. And we really like talking about that, having reports, artificial intelligence themes, visualization, sharing data with third parties, machine learning. In the case of Microsoft, we have other things that are associated to that for cancer. This is not fiction. They're already being used. They're used in clinical practice. They're not just limited to research. So it sounds very nice, doesn't it? But they are part of the health process. So Microsoft has been working very intensely to do that. And this is one of the entities that is making this option for its risk assessment and risk mitigation processes. So in healthcare in the recent years, there is a model of repairing whatever was wrong. So, for example, the medicine is based on repairing what was wrong. Just someone has an appendicitis, they go for surgery, for example. So someone, for example, doesn't exercise, doesn't like vegetables, smokes, drinks. So these are all risks. So it's not just about giving someone something to correct a problem, but we need to work with prevention. We need to understand the risk factors and have a full health management process. So the WHO has creating a health system to work with preventive. So health between people, from people to people. It's not just between processes and people. But let's say an appendicitis. So there is a process, appendectomy. No, it's a care process, there's surgery. And that's it. Really, really. It may be the case. So this is the case. It's not a process, it's case management. So now we are managing people and cases. And Microsoft has worked intensely in terms of collaboration. And so this is the greatest ally in discovering during the pandemic with telemedicine. And so it's not just a visit, an appointment with a doctor. We are capturing information. There are many priorities and themes, but which experiences are there in that area? So we have entities, for example, in the Ministry of Health of Singapore, that before the pandemic, they were using capture information of citizens, what they eat, what they do, if they exercise, and then they upload it to the cloud using artificial intelligence algorithms. They can predict what is the best recommendation for those people who were during the pandemic, wherever they were, and to see that people who exercise more, who had a healthier diet and had better weight control, wow, they had a lower risk. So this helped people change their lifestyle to avoid the emergence of diseases and to reduce risk, which was something of a very high cost effectiveness. We have had very similar experiences in Latin America. We had a provider in Colombia providing care to millions of people. But during 6 years, they were integrating a digital aspect. They could reduce chronic diseases in patients for which they received $500 a year to do all healthcare. So it's not utopical. It requires a number of processes and integrations. At Microsoft, we have the technology and we have worked with architecture and the process of design thinking to do things to make them agile, fast. We have Stefanini and other participants, for example, that are in certain niches have made it possible for us to get to a customer, understand what they need, their collaboration capacities, analytics, information integration, and to enable that to provide care to patients. So I know I spoke a lot, but these are my experiences. Artificial intelligence will not displace professionals. It will help them to work. So it is a work that has a certain time and a certain risk. We didn't have that in the past. We have that today. Number two, privacy must be assured and protected. This is critical. And for Microsoft, privacy is so very important that all our cloud needs the PDGR, and they have, this is related to all countries. So it's not segmented. It works in the entire cloud of Microsoft. So whenever something is built, it will be compliant with all secrecy laws, whether it's in Europe, Latin America. We are meeting all the regulations in terms of data protection. Something else that we have been working in Microsoft is the use of artificial intelligence. We already have some experience. We've been working with technologies, and this has made it possible for us to discriminate trends. Microsoft has an area dedicated to artificial intelligence in terms of public health, security, and they are our pillar for the use of technology. And this is all I wanted to say. This was an overview and all the backdrop that I wanted to give to you and the standards that we've been using. And this is everything that we are promoting. Great, Dr. Alonso. Thank you very much. It's very important to know that big players in technology that are so strong are investing in artificial intelligence, in the handling of data in major volumes, and taking in consideration 2 points that I found very important in what you said. Number one, the ethical issue. So much beyond the simple safety or security or privacy, ethics in the use of artificial intelligence. We as civilization, we're still beginners, we are novices in terms of artificial intelligence. We still have a lot to learn in this area, but it's important for us to create knowledge, to create education on artificial intelligence, and to build it over solid foundations, which is ethics, good practices for technology. Another point you mentioned, and which I cannot fail to mention, and this is going to be the connection with Dr. José Carlos, is precisely the issue of costs. So when you talked about health costs, I remembered a story in The Economist, and they questioned some technology managers. They asked the question to many technology managers, which are the main challenges that countries must face in the area of health. And number one, they talked about health costs. And then Dr. José Carlos, who worked in public management in a huge environment, Rio de Janeiro. And then please share with us your experience. How is artificial intelligence and new technologies, how did it support and are still supporting your initiatives in health prevention?
Good afternoon, and thank you, Bernardo, for the opportunity. I also want to thank FIS for the invitation. I had the opportunity to experience 7 years of administrative work in Rio de Janeiro in the public sector. And then in Sao Paulo, I also had the opportunity to work in healthcare insurance provider and also a large operator, a multinational operator. So I was able to expand my perspective. And I must confess that in supplemental health, there's a lot more opportunities to this kind of technology and this type of, well, even the startups, in terms of contact with them, exposure to events, and so and whatnot. So I think this is the first aspect: is asymmetry of opportunities, and how much we're moving towards a more unequal society with inequities. And I think that's one thing we have to think about. But technology, regardless of whether it is the public or private sector we're talking about, technology is there and we're being monitored constantly. Uh, Increasingly more scientific articles are being elaborated and published using artificial intelligence, which seemed impossible a few years ago because we always used the criterion of the methodology of classic epidemiology, and there's really an invasion in large journals, and there's also a generational aspect. People are using increasingly more this type of tools and apps and gadgets. They're younger and tend to use it more and more. And currently, algorithms are currently commodities, whereas in the past, algorithms themselves were kept locked away somewhere, but not so much now. They're public domain. What's really relevant now is how to apply these algorithms and translate them into useful and relevant information to society. So if you ask me how I see the future in promotion and prevention, well, precision medicine, I think, is a trend, and will be offering more and more personalized care to people in a social context where it's not associated to reality of the neighborhood and the environment where they're working, but increasingly more offer personalized solutions, not only in the private sector, but also in the public sector, in the private sector, and in the public sector. In Rio de Janeiro city, for instance, there's an app that is the entry door for users to access healthcare systems and a management platform where healthcare professionals interact with users and very strong analytics where you can translate entire set of data to information that's useful to the decision maker. And I like it when it comes to prevention and promotion. Use the risk pyramid, which allows us to provide greater care to those in healthy. We will offer a non-cost effective solution as all patients can manage them. But we're going to use devices or apps that allow us to measure the well-being of patients and measure their mental health is, and also chatbot strategies using robots where you can communicate with the population at very low cost with the same impact as you would have if you had a human being talking to the patient. So we're talking about um, primary promotion and prevention. So we have several channels. I think that one gap that is still huge is in terms of how we can be more effective in terms of having a virtual appointment where some fundamental aspects that we learn at medical school are not there, such as propedeutics. You can even do that remotely, but the physical contact, how to replace it. So there's several devices that are being developed, very interesting ones, but they can't solve thing. For instance, no patient. I know that there are startups trying to solve that, but it is still a big barrier in that regard. And I see future and evolution of what we're now seeing. If you look at the pre-pandemic scenario, 67% of medical equipment sold in person in the public sector. The digitization started this year with the administration of Mayor Eduardo Paes. Secondary prevention, it's very important to use artificial intelligence tools and to do early diagnosis. For that, predictive model to identify in your population the possible diabetics, and here the private sector is in disadvantage because they do not have information about clinical data, and in the healthcare operator, you have no contact with the medical records unless if they're totally organized, but you have no contact with the clinical data. The forms they basically focus on cost. So we have to develop AI tools to predict the investment needs of patients becoming hypertensive and diabetic, uh, as well as imaging exams and skin lesion exams in the labs for you to do early diagnosis of cancer, for instance, and start uh, correct patient journey. After you start a patient journey in a not so correct manner, it's harder for you to change that journey or almost impossible. There's also the aspect of patient engagement, patient loyalty with that specific healthcare provider. And focusing on public health, I think that uh, with risk stratification of our population, we're able to get to know our population better through primary care. We have family doctors, family nurses, and we can get to know our population from a clinical standpoint. So that's yet another advantage if you compare it with supplemental health, which is much more fragmented than public health. And once you stratify that, you're able to provide the better care. And if you use the app, it comes as default. So you can list your patients with high blood pressure, diabetes, and for those ones with scientific evidence, you can intervene in a more personalized manner with predictive models and also predict negative outcomes for those patients. And healthcare surveillance, that's yet another important aspect where by means of AI methods, clusterization, and analyses of components. And also, why not, by using more sophisticated algorithms of methods, of neural methods, such as deep learning, to really identify these patients and clusterize them. For instance, patients with TB according to the social demographic profile of patients, and also improve the accuracy of location. And we had a very interesting experience during the pandemic, not only in the public sector, but I think the public sector led that, which is the fact of using social media to define whether people are maintaining social distancing or not. So you can break that down by social economic profile and etc. And in Rio de Janeiro, we were doing risk stratification and using chatbot to communicate with people. So communicate with people is one of the biggest benefits in the public sector because you have no scale establish a centralized communication with the population. But at the same time, you have to use AI tools and chatbots to reach out to that population and stratify who needs human contact and redirect them to the primary care team in charge of the patient to reallocate them to at-home visits or set up an appointment for patients with gaps in their treatment. I think that's it. I could talk more about that, but well, that's what I had. And if there are any more questions, I'll be able to contribute more. It will be a pleasure. Thank you, Jose Carlos. Thank you for sharing that with us. And well, that was really a lecture. And we saw at the beginning of your speech something that Dr. Alonso also touched upon, which is using AI to customize customer care. Because treating a patient, I'm not a physician, I am an engineer, and we see that physicians will try to give specific treatments to patients, but on the other hand, using AI strategies, big data, and gigantic amounts of data allows us to care for the population as a whole. So it connects both ends. We're talking about both possibilities, a super personalization in healthcare as a whole. I also saw that you mentioned something related to what I work with it, which is supplemental health and its challenges. We have a strong team in data at Ask, and we carry out several studies. We had a specific study about terrorism to find out a better path. And that was the conclusion we came to in terms of cost effectiveness and patient outcomes. So we added the categorism events and the guideline, which is the guideline for hospitalization, where you're able to at least get an ICD code and we're able to optimize it and bring information about paths that for the patient treatment and for the healthcare provider. And so the application of AI in mental health. Of course, there's these factors, and that's what's interesting in the private sector. Very strong in processing, and the algorithms, as you have said, they're more open. But in terms of processing, there are other initiatives, and the public sector has great database that is huge and that we have to leverage, of course, in a secure way, but that has to be leveraged. And now we already have a few questions. And well, the first question is how does the work with the social determinants of health? I'll ask Dr. Alonso to answer that, but then the other guests can also comment on that, please. Thank you. Thank you very much. The social determinants of public health, and I agree with the colleague that talked about public health, and it demonstrated that in the last year's being able to change that health by population health in an integrated manner, not only by building new hospitals or expanding that by placing other doctors in hospitals. When it comes to social determinants, we're talking about education, access to water, and for instance, drinking water and areas for leisure and entertainment. And among all of that, in that context, artificial intelligence, when you recover by means of big data, the data of individuals in a context, in addition to their social aspects, you're able to create models to predict risk and to predict which social determinant makes a certain community more relevant as compared to another.
It is appropriately used, and considering the social determinants and risks, it makes it possible for us to communicate and also to find which are the priorities to improve impact. and also the emergence of chronic diseases and other problems. There are some very, very interesting experiences with that regard that would be very interesting to use artificial intelligence for prediction of risk when someone has a positive test. And also based on that risk, we would prioritize. So if someone with a higher risk, you're going to do certain things, then we need to make changes in lifestyle, or just the usual follow-up. And the reports that we have had so far in terms of technology, it is an important impact. But these are basic algorithms. But yes, they were strong enough or important enough to change outcomes. The other thing is the NHS, the British health system, they use in a safe way algorithms to manage chronic degenerative diseases and things like life events. For example, a diabetic person who gets a divorce. This has an impact that might lead them to fail in compliance with the treatment, and they may worsen the disease. For example, they may have amputations or even worse things as a consequence of diabetes. So these types of elements using artificial intelligence have made it possible for operators and providers to see this and could respond to the care of risk groups. Another important thing with social determinants of health is to define risk. And so there may be a group of persons with a certain strategy assuring that there will be a positive impact. There are many experiences, things that can be done in terms of methodology. But thanks to artificial intelligence, now it is possible to make operational. Oh, great. Still talking about the social determinants of health, I'm going to go to the other end and I'm going to ask a question, which is the following. Artificial intelligence in the world, and we have heard of many possible applications, but in mass, as it's been said, it's very strongly applied in recommendations, in the banking industry, in other business areas. This is very strong. In health, we still have a long, long, long way to go. So it really makes sense to have this chain and this space, which is slightly more, which is slightly slower, because we are treating people and there's a very strong criticism. Now, if we think in terms of recommendations, and then we think you watch the video and you watch the wrong video, and then you may take it on, you will never remember that that happened. That will not cause a problem. In terms of health, one recommendation, the wrong recommendation, using an example indicating a specific case, which is artificial intelligence for the recommendation of some treatment or some form of care. Now, if artificial intelligence makes a recommendation that is mistaken, and this is not impossible, it can make mistakes, this is a huge risk. I have one vision, and I can give one opinion, is I think that artificial intelligence combined with the healthcare workers, doctors, and other healthcare workers, and then we will be able to make it evolve. I would start with Felipe. How can we evolve, make it progress slightly faster in terms of artificial intelligence in healthcare applications? Well, this is a very important theme. And then it converges. It looks like scientific intelligence. So it's a robot that is a physician that is going to make the diagnosis. We are not seeing this. This is really a delicate issue. there is an issue of that we need to test after tests, many tests, with less complex themes. So really, in fact, testing it on a day-to-day routine, for example, in terms of nutrition, something that we can validate, test, until we have a higher accuracy. For medical images, it has been evolving very fast. Maybe risk stratification, filters. It's moving forward very fast at a very interesting pace, but with many warnings or cautions that we need to have, having dedicated people to do the work. And this is a more complex work to understand. And each person will make the necessary triangulations. So what we have been seeing is this: how can we get other experiences that would not put people's lives at risk, and then we start working in health with simpler issues, for example, helping people in their day-to-day lives, how they can make small routine adjustments to improve well-being, quality of life, and we start scaling it up of how a nurse can use the data so that once they go back to the clinic, office, hospital, they have intelligent or smart data there available, easy to detect, to then take an action as a healthcare worker. So we see that there are some ways or paths that are somehow still complex, but we'll start validating a few hypotheses, and we are going to gain more space on these themes. So this is a very complex theme. And so I still have the vision how startups have been doing in terms of testing, small hypotheses, testing with a specific audience in terms of results. And I think it's a vision that we need to somehow embrace too, as large corporations, as big companies, so that we can evolve together. And this is something that we have been seeing. And this is what we are seeing here. Well, I agree with your trajectory of us being able to define small plans. When we talk about startup, we say, well, let's do fast so that we make mistakes fast. Let's have a pilot. So you implement a pilot study, and then I learn more, and the audience is also getting to know. Sometimes in AI, this is something new, and then in more controlled and lower risk environments, and then people may get used to it. Well, we are running out of time. I'm going to ask a very brief question, and this is to Dr. José Carlos, because I think he will be able to answer. How can we democratize to the benefit of the majority of the population, maybe make it available to public services? This question comes from Mauro Bakanovsky. Dr. José Carlos. Excellent question. Thank you. I think that this has a lot to do with the relationship that we have with the public sector, which today is very not really flexible. So when you relate to the private enterprise, there are many regulations that many times prevent you from having agility and from your being able to have a pilot study and then making a mistake. Because if you make a mistake on a startup, cool, nice, well, that's even positive for you. Yeah, well, rapid pilot, it's well seen. Now, if you make a mistake in the public sector, you're wasting taxpayers' money. So we need to change a little bit the mindset of control agencies. And there are some interesting initiatives. For example, the city of Rio de Janeiro implemented like a startup hub, not for health, but focusing on sustainability, and it has more related to the previous question of social determinants. So startups thinking of sustainability, thinking of violence, and solutions, sustainable solutions for the city. And then you have an incubator of startups, and then afterwards you can establish a business model that will be slightly more agile. In health, I have to admit that we weren't able to do that. There were two initiatives this year that were very interesting and more generic, and plus 10 or 20 donations related to COVID. But it's always a huge difficulty. So for you to be able to democratize, it's like changing regulations, health regulations. Another point which I find fundamental is for you to be able to democratize source codes too. And this is very nice. If we take the main companies today, they used to use in the past very expensive and complex systems. Today, we have collaborative systems such as R, Python, and they're the best ones for you to conduct more elaborate analysis. So it's a matter of developing people and talents with a new mindset. So you don't have professionals that have an education, not even in a private, to be able to manage the entire transformation. So in the public sector, this is very necessary. So people who can use data analytics, people who can mine data, do data mining and transform data, because there's a huge volume of data. So you being able to streamline the data, such as the example I mentioned, that are 500 variables in surveillance, and with 20 variables, then you have the same result. Well, so regulation, making codes more democratized, open, and more collaborative. And number three, education. Oh, wonderful, thank you. I am going to very briefly, 30 seconds each, to say goodbye. First, Philip. And so thank you very much for the opportunity. I think I learned a lot from you too. It's always super interesting to talk to you. Thank you very much for this conversation. I think that this issue is very complex. Still, we're still learning. We're still understanding how to relate to that. But just one point that I would like to understand is that in the area of technology, we say technology in itself sometimes is the easiest or least complex part of it, of everything that we are talking about. The most complicated sometimes is behavior, culture, design, how we are really going to put them into people's lives. So just in closing, thank you very much once again. And that's it. Thank you. Dr. Alonso. Well, thank you very much. It was a pleasure to share ideas with you, Philip, José Carlos, and Bernardo. From the standpoint of Microsoft, and our technologies and capacities are available. We use open sources. We can have pilot studies. We have very attractive terms, and we can share experiences. And we have excellent experience with patients using AI. The reality is that this is here already to stay. It's an important methodology. There's an adoption process, and people need to benefit from that. If you want to democratize, we have a methodology to provide access and to protect privacy and to implement in this area. Thank you very much. Thank you, Dr. Alonso, José Carlos. I would also like to thank you for the opportunity, Bernardo, Felipe, Dr. Alonso, Dr. Alonso. It's a great pleasure for me to be here. And I would like to say that whenever I hear and talk about this theme of AI, I'm on a postdoc study on artificial intelligence, and there is a certain glamour when we talk about it. But it's important to demystify artificial intelligence. It's not so much true that there is a robot that they will learn everything and walk around and solve our problems. I think that the main issue is applicability. Can I apply it very well for the benefit of people, or was it the opposite? Would I cause harm to people? So the ethics and really regulating its use of these tools, which are very powerful, and they're gaining more and more utility. And all the best for us to lead more sustainable and democratic lives with more access. And that's it. This is my final message from our discussion here. Thank you very much. Thank you, everyone. Thank you, Felipe, Dr. Alonso, José Carlos. Thank you, FIS, for the initiative and for promoting this type of meeting. This is a very important meeting for us to share knowledge, to share realities, experiences. And I agree with you. We are going to grow in AI and health technology if we make it democratic. Bear in mind ethics and safety. This is very important. Always person-centered. Let's put the person at the center of all of this and find logic and meaning in everything that we are doing so that that person, that individual will benefit. So I'd like to thank on behalf of Ask. Thank you very much. Have a good afternoon.